Today we'll be teaching about H. pylori and peptic ulcer disease. So what is H. pylori? H. pylori is a bacteria. Okay, it is a gram-negative bacteria. Then it is got urease enzyme positivity. That is what helping it to make a alkaline environment in the stomach, because we know that in stomach there is HCl secretion by our stomach parietal cells. So this parietal cells HCl is neutralized by urease enzyme to produce a alkaline environment so that the bacteria can survive. Then most importantly, it has got two factors inside the bacteria, that is CAG-A and another is VAC-A. These are the one that is causing the pathology, including adenocarcinoma stomach. So this is the microbiology of H. pylori. Now let's come to the disease, what it causes. Let's do the pathology of H. pylori. So it causes first gastritis. So let's talk about the gastritis. So we know this is the stomach. I'm sorry for a bad diagram. So we know this is body, this is fundus, and this is antrum, and this is pylorus. These are the part of the stomach. So H. pylori typically affect the antrum here. H. pylori affects the antrum of the stomach. So what is there in antrum is, antrum contains D cells which secrete somatostatin. So what is it in normal people? In normal people, let's see what happens. Antrum secretes somatostatin. That is D cells. The somatostatin will block the secretion of gastrin. Gastrin is secreted by G cells, by the way, in the stomach. This will decrease the HCl secretion. So, in H. pylori infected people or peptic ulcer people, what happens is these D cells are destroyed by this H. pylori, because we know that H. pylori infects the antrum of the stomach. So let's see what happens. There will be decreased somatostatin because there is no D cells now. So gastrin, nobody is there to inhibit gastrin, so there will be increased gastrin. There will be increased gastrin level, which is called hypergastrinemia. Next, due to this, there will be increased HCl secretion. That means there will be more acid in the stomach that will cause all the problems. So this type of gastritis is called, that is the gastritis associated with the H. pylori is called type B gastritis. So let's see what is type A. Type A typically means autoimmune. So A for autoimmune. Autoimmune. For example, we all know about pernicious anemia, where intrinsic factors secreting parietal cells are destroyed by the autoantibodies, so that there will be no absorption of vitamin B12, so leading to vitamin B12 deficient anemia and stuff. So we need to know this. Type B is caused by H. pylori. That is the thing. So let's move ahead. Let's see the investigation. How can we diagnose this thing? So there are so many ways whether we can diagnose peptic ulcer disease or H. pylori infection. So it can broadly divide into invasive and non-invasive. So let's first talk about invasive. Definitely, first is biopsy. That is endoscopic biopsy. We put the endoscope, we take a specimen, and we will observe on this thing. What is in microscope? And the stain used is Warthin silver starry stain. Warthin silver starry stain, which will make the H. pylori stain black. That is endoscopic biopsy. Next is rapid urease test. I've told you about H. pylori secretes urease enzyme, right? So what happens in rapid urease test is this is also an invasive test. We put an endoscope into the stomach or the duodenum, wherever it's affected. We take the tissues where it is affected by H. pylori, visibly affected by H. pylori. So we will take the sample. Instead of doing a biopsy, we test a urease test in that. So if urease test is positive, that means this is positive for this is positive for H. pylori. Now coming to the non-invasive test. So these are non-invasive tests will be the test that we usually use for screening and stuff, because for screening we don't usually do invasive tests. Invasive tests are we usually use for diagnosis or confirmation of the diagnosis, right? So non-invasive, first one more important what we are currently using is rapid urease test. So in this, we are not passing an endoscope or anything. Instead, we are putting some carbon particles. We are coating some carbon particles on a substance, and we tell the patient to swallow it, and the patient will exhale after on, and that we measure the carbon dioxide levels in that uh, exhaled air, because we have told you that there is we know that urease enzyme is present inside the H. pylori. So what happens is whenever this carbon containing this thing is swallowed by the patient, this urease enzyme present in the stomach, that will convert all the carbon particles into CO2. So we measure the CO2 levels, and if the CO2 levels measured are increased, then that means there is H. pylori in the stomach. Okay, now, yeah, these all are the tests that I wanted to talk about. So we should know that nowadays this is used for screening, rapid urease test, because it's a less invasive test. Then another test we use is that a detection of Ig, that is antibody immunoglobulins against Ig ELISA. Sorry, sorry, we use ELISA. What is this? We use ELISA to detection. Then we use tool antigen detection. So these all are used for diagnosing, not diagnosing in per se, but yeah. Most importantly, in this non-invasive test is rapid urease test, because it's very rapid as it says, and it has a good sensitivity also. So this is the investigation what we use in this thing. Then invasive things are used for confirmation of diagnosis. So if somebody ask you what will you do to screen, then definitely your answer should be rapid urease test. So invasive test are uh, for the confirmation of the diagnosis. Now coming to the complications. So complications first is gastric or duodenal adenocarcinoma. Okay, that is one of the risk factor. So there is an interesting point here. I've told you about uh, yeah, gastric or adenocarcinoma, right? Next is low grade, not low grade, maltoma. Maltoma means mucosa associated lymphoid tissue neoplasm. Okay, so basically we know that in submucosa, sorry, in the mucosa there is lymphoid tissue in GAT, right? So like for example in ileum we know that it's a pairs patches. So if this tissue undergoes a neoplasm, neoplastic change due to this thing, so there's an interesting thing here that I wanted to know. If it's low grade, it's low grade, we treat it as an H. pylori infection. So the treatment will be eradication of H. pylori. So we basically give antibiotics, which we usually give to H. pylori. If it is high grade, then we treat it as a lymphoma. As a lymphoma. So we know that in lymphoma we give R-CHOP regimen, rituximab, cyclophosphamide, hydroxydonorubicin, then ongovin and prednisolone. So R-CHOP regimen. That's an interesting thing. So that will be all about this. So let's talk about first microbiology, coming to gram negative, urease positive, two factors, Kage Vake. So that is the one which is leading to adenocarcinoma. Then coming to pathology, gastritis, which is typically occurring in antrum. Antrum, it contains D cells. Antrum contains D cells which secrete somatostatin normally. So what happens is when it is affected by H. pylori, there will be no more stomatostatin. So there will be no inhibition on gastrin. So increased gastrin lead to increased HCl production, that we know that. So this type of gastritis is called type B gastritis, and we should know that type A is also called, type A gastritis is autoimmune. Now coming to investigation, whether invasive or non-invasive. In non-invasive, we have rapid urease test. We know that carbon particles are swallowed, and we measure the carbon dioxide level in the exhaled air. Then we can also do a non-invasive ELISA test, which detect the antibodies of the H. pylori. Then we can do stool antigen detections, which detect the antigens. Then coming to invasive, which are used for confirmation of the diagnosis, endoscopic biopsy, rapid urease test. Rapid urease test, we know that it's basically take the endoscope, take a specimen. In that, you are conducting a urease test. Now coming to the complication, then this is gastric or duodenal adenocarcinoma, most important. Then maltoma, which could be low grade or high grade. Low grade, we treat it as a H. pylori infection. Uh, we just give antibiotics, and in high grade we give as lymphoma we treat it.